Well, Dr. Mallika Marshall is a trusted source of information, particularly during the pandemic, and many of you continue to reach out to her with your questions. Dr. Mallika joins us now live. And Doctor, I know you're home after getting your booster shot. How you feeling?
Well, first of all, I have to say 10 seconds before we went live on air, someone's mowing their lawn and my dogs are barking, so
That's
please
the way it
forgive me.
always
This
works.
is what it's like being back
Right?
at home. Right? I'm like, are you kidding me? Quiet. Anyway, yes, I got my booster. I was so grateful to get my booster shot on Tuesday, and I wasn't feeling great yesterday. I've had some body aches and some left arm pain where I got the injection. I've had more pain in my armpit than I did for those first two shots that I got earlier in the year, but all in all, not bad. No fevers, no nausea, and I'm certainly feeling better now than I was this morning, but that's the main reason I'm at home today.
Okay, well, I'm glad to hear you're feeling a little better. And Doctor, we do have some questions, so let's get to those. Jan wants to know, should I get the booster if I received the Johnson & Johnson vaccine and came down with COVID afterward? I'm 73 years old.
So right now, we're not recommending that people mix and match vaccines. So we're waiting to hear with bated breath about the J&J boosters. What's going to be recommended? Is it going to be suggested that people get another J&J shot? Or is it going to be suggested that they get a shot of the Pfizer or Moderna vaccines instead? Having had COVID on top of being vaccinated, you probably are enjoying a little bit more immunity. But until we can sort of sort out this whole J&J booster business, I would continue to take precautions to protect yourself.
Okay, and here's someone else who may have a bit more immunity. Trudy has a breakthrough infection, doctor, and wonders, is it possible I can get a breakthrough infection again?
I know, that would be awful, right? So theoretically, yes, but assuming you're not immunocompromised because you're fully vaccinated and then got a breakthrough infection, you probably are enjoying a sort of natural boost in your immunity against the coronavirus, which hopefully will protect you from getting infected again, at least for several months. So if you're over 65 and you have underlying medical conditions, I still would talk to your primary care physician about whether you might need a booster down the road, but right now, enjoy that added immunity.
And Zonda asked, Doctor, how long is it wise to go without anti-inflammatories for headaches before getting a booster shot?
So if you're on anti-inflammatory medication like ibuprofen or naproxen, for example, for headaches or underlying medical conditions, you can continue to take those medications. What we don't want people doing is pre-medicating with fever reducers and pain reducers in anticipation that they might get side effects from having a vaccine. But if you take them normally in your everyday life, then you can continue to take your medication as is.
Outstanding. And I think the landscaper wanted to hear all of those answers because that magically stopped right when you started to speak. So that worked out pretty well, Doctor. Thank you so much.
Very quiet.
And feel better. Dr. Mallika offers her best advice, but as always, consult your personal doctor before you make any decisions about your health. If you have a question for Dr. Mallika, there are 3 ways you can reach her. Her email, drmallika@cbs.com, on Twitter, @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall.